It's time for this week's segment of Happier at Home. We are joined by Deb Marcello, and today we're talking all about living with hand pain and tremors. Hey, Deb, good morning.
Hey, good morning, my friend. How are you?
I'm well. Thank you so much for waking up and talking about this. So talk to us about this. This seems like it's something that's progressive and is something that comes along with aging.
Sure. As we grow older, the likelihood of having osteoarthritic pain in your whole body, but specifically your hands, and also tremors in your hands increase. So oftentimes medications don't completely take care of the pain or the tremors. So it's really important to know some adaptive adaptive measures that you could take to help both the pain and the tremors as well.
Because this is not just a strictly an aging thing. This can also be a genetic issue, correct?
Sure. Essential tremors are most of the time caused by genetics, and as you age, that likelihood increases that you get that as well. Parkinson's disease can cause the tremors as well. Osteoarthritis oftentimes is a genetic, you're predisposed genetically to develop that as well. So it's really important to know all of your options. And, when we look at osteoarthritic pain, I remember seeing my mom all the time holding her hands, so that pressure on your hands really helps sometimes to relieve the pain. So one of the things that you can do is simply on Amazon or online, you can look at these compression gloves that will help to relieve the pain. Also, there are thumb splints that you can purchase over the counter that help with your pain that's in your basal joint, which is the base of the thumb joint. This is one of the very common places to have arthritis. And actually, I've had it before, and those thumb splints really help. It does not cure, but it helps the pain and helps give some support when you're using your hands as well. There's adaptive utensils, both for the tremulousness and the pain. Adaptive can openers, things like that could really help.
Deb, if you can you talk to us about the emotional and mental impact that this can have on people? Because when you're impacting someone's motor skills, that's certainly a downer. That, I have to imagine, takes a serious toll on people.
Well, if you've ever seen anyone just trying to simply eat and has Parkinson's or has the tremulous hands, they shake so violently that they really can't bring soup to their mouth or something like that. So it is, when you see someone use some of this adaptive equipment, it's almost life-changing for them. One of the things for those with tremulous hands that's really an incredible invention is our gloves that are weighted on the back, something called a Ready Steady glove. And that really helps to just stop those tremors so they could eat or they could write. It's amazing. And you could see their smile on their face when they try it.
Yeah, I actually, now that you mentioned it, I saw something online this past weekend on social media. It was an adaptive device with like a gimbal in it so that someone with hand tremors could still write. Phenomenal stuff. I mean, the minds that come up with this, just absolutely astounding, but certainly can present challenges for the aging community.
Yes, there can, but there are resources out there. So if anyone needs anything, they could contact us and we'll help point them in the right direction as well.
Right down the road I wanted to walk, and where can they get in touch with you, Deb?
They could reach us at happieratHome.com, and we'll have this blog on our website as well, so then you'll be able to see where these resources are too.
Perfect. Deb Marcello from Happier